there's a client whom I've worked with who came in, and her presenting issue was to deal with some anxiety that she had in a relationship with her boyfriend. And she is an immigrant, and she grew up in the United States most of her life. She's Black, she's Afro-Caribbean, and she was describing her relationship with her boyfriend, who's white, and she couldn't figure out why she couldn't deepen her sense of intimacy with him, even though she felt as though she was in love with this person and that he loved her. And she couldn't quite figure out why she couldn't settle into the relationship. And so a couple of months into talking about the relationship and her family of origin and just the course of their relational history, just in passing, she told me that the first time that she and her boyfriend met, that he told her that he never thought that he would be attracted to a girl from the Caribbean, and specifically referring to a girl with darker skin. And she continued to sort of move on in the conversation to something else. And at that moment, I heard something that seemed to be important. I didn't quite know what that was, but I stopped her and I said, well, what did you feel when he said that to you? And she said, well, at first it didn't really bother me. Didn't quite, I don't know, I didn't take it personally. But over the course of the conversation with her, it became more and more apparent that, in fact, there was something about that unconsciously that she worried about. It raised for her an anxiety of whether or not her boyfriend could really understand her experience as a Black woman. She wondered if he could really understand her own fears of whether he would find her attractive in a few months, in a few years, and whether she was being compared to a different standard of beauty. And so this issue of race and racism, that manifested in the relationship in that moment with her boyfriend, was connected to previous experiences and ongoing experiences of racism that she has faced and continues to face. And the two really were, I think, in the conscious level, seen as separate. They existed in separate universes, but unconsciously, they were very much a part of the same problem. And so had we not explored that further in the therapy, then I could have very well attributed her issues, her concerns, her presenting issues to a fear of intimacy, and connected that back to her family of origin, perhaps, or other things in her life, rather than really trying to see that there was a source, a deeper source that was connected to a social problem, which impacted her every day of her life.